So let's talk about sutures in the skull. Sutures are really important because they're going to serve as joints that connect cranial bones to one another. And the cranial bones are the flat bones of the skull, and they form by intramembranous ossification. And the sutures are these kind of serrated lines that you're going to see in between cranial bones. And sutures basically form a type of expansion joint in the cranium or the skull cap. And so in babies, before it's fused, it's going to allow for expansion of the skull to account for growth of the brain. And then starting around 2 years old, the sutures are going to close. They do technically remain a joint, but they are an immovable joint. They're a fibrous synarthrotic joint that doesn't allow movement, and so it gives us a lot of protection for our brain, and that's what we need after they're fused. So there are 4 main sutures that you need to know about. The first one is this suture here. If we go from the side across the top of the skull, so this is going to be the suture connecting the frontal bone to the parietal bones. This is going to be my right parietal bone. If I look on the other side, I've got my left parietal bone here. And this suture going across the top is the coronal suture. If you remember when we learned planes of the body, frontal plane and coronal plane were synonymous with one another. And frontal plane, if we cut, it would cut the body in an anterior portion and a posterior portion. And that's exactly what we have here. It kind of sits across the top of your skull like a crown. Okay. If we look at the skull from the top, we see this suture here, and it's connecting our left parietal bone to our right parietal bone. And this is the sagittal suture. And this is kind of nice too, because this terminology makes sense. The sagittal plane, if we cut the skull in the sagittal plane, it's going to give us a left part and a right part, and that's exactly what this sagittal suture does. If we look at the skull from the lateral view, we should be able to see, it's a little hard to see on this model, but there would be a suture line here, basically connecting the temporal bone to the parietal bone, and that's the squamous suture. And you're going to have a left squamous suture, and then we would have the same thing on the right side. And then if we look at the skull from the back, you're going to see this suture line going across the back of the skull. So it's kind of like an arch. It's this suture line here, and it's connecting the occipital bone in the posterior aspect of the skull to the parietal bones. And that's called the lambdoid suture.